I confirm that that is true. Okay, moderator, please stop me when I've already used all my time. I think that my main task will be to keep you awake for the next 15 to 20 minutes. I'll try to do my best. Okay, the question is if digital health has really fulfilled all the promises. And I would like to talk a little bit about the context in which we live today. And of course, there would be no news. You know it probably already. What are the unfulfilled promises? And what are the barriers that we have experienced in trying to deploy at a large scale digital health? And also, I would like to comment a little bit about the famous issue of best practices, if they are really useful or not. Okay, the context in which we live, Western Europe, is an aging society, as you know. There are two different phenomena at work. On one side, we do not have enough babies, so we should do something about it. It's too late for me, but there are a lot of young people in the room. And the second one, we never die. So actually, the life expectancy is going up all the time. And the bad news about it, that these two phenomena are not likely to disappear, and certainly they will not go backwards. So we have to get to terms to the fact that we are going to have an aging and a more and more aging society. Okay, but that has consequences, and they are not all positive. On one side, we know that by living longer, we'll one day we'll also develop chronic diseases and will become frail even before we develop chronic conditions. There will be a deterioration of the dependency ratio of many people are in the productive system compared to the people actually pensioned, already retired. And there is a shortage not only of money but also personnel in the care sector to cope with this demand. So the problem is serious. And in reality, some people say, especially in Northern Europe, that the system that we know today for health and social care will not be sustainable any longer, and we're not talking about 2050, we're talking about the coming years. So we also know another thing, that we try to make small changes, and unfortunately, these small changes are not really producing results, so that is not going to work. So the question is, if we are all convinced that something radical should be changed to satisfy this growing demand for services and for keeping the system sustainable, why so little has happened so far? So quite clearly, there must be at least one explanation, but in reality there are several explanations. So first of all, I was also a victim of this kind of forecast about a booming market for digital health, especially in some areas like home rather than hospital residential care, patient empowerment, self-care. I'm pretty sure that we have already heard all these terms, and for sure there are some other unfulfilled promises. And why they have not really fulfilled until now? I think that there are many possible causes, and probably more than one has acted at the same time. The first one, immaturity of technology. Trying to do something 10 years ago was not going to provide results simply because the technology at the time was immature. It was very expensive. Some people tried very early and they were very disappointed about the results. And once you've been disappointed, you don't want to burn your fingers again. There is a huge risk, and actually I would say that is one of the things which should happen, a major disruption of existing clinical practice, and people not always like to change the way they have worked until now. There was a lot of technology push. People were trying just to sell technology per se, instead of thinking about the headaches of the users, the fear of changes in the physician-patient relation, the absence of a clear legal framework, who is responsible in the case of data which are collected at home and I'm the medical doctor, liability concerns. What if I don't react to data saying that my patient is not in good conditions? And let's say there are some other barriers which are totally outside our control. The first one is financing of the care system. If I only paid for curing patients and actually I prevent people from getting sick and I'm not paid, something is of course quite wrong. And everybody's saying that we should really encourage prevention instead of cure, but I'm not sure that we do the right things for that. There is a resistance to change by care professionals. I've spoken with many people about it, and all of them seem to be in agreement with that. And finally, there is a lack of evidence of the impact, and especially on cost-benefit, when you deploy these kind of services and you reorganize your services according to the possibility offered by digital health. And quite strangely, technology is never mentioned as a barrier to the deployment of digital health. So there's plenty of technology, it's reliable technology, it's a cheap technology, it's already in the mass market. Actually, we did something quite interesting. We did a survey interviewing 158 people in 10 different sites throughout Europe. And actually, the main barrier that they indicated was how commit professionals to new care processes. What can we do for removing these barriers? Of course, if I could decide tomorrow about financing care in a different time, I would probably do it, but I don't have that power. But what we can do is actually providing evidence to the politicians, to the people having the possibility to decide about it, to do something before the system collapses. The second point about the resistance to change by care professionals, to develop change management tool and to be able to coach people about how to convince people to push in the right direction when you introduce a huge innovation. And for the lack of evidence, to use the very best of the data that we have collected. We spoke about this enormous amount of data which are already there, and also to develop predictive models to extrapolate the experimental results to longer terms or to different contexts. Okay, I have a kind of, let's say, maniac reaction about best practice. And I make an example comparing two different regions. And I put myself in the shoes of the Ministry of Health in Andalusia. And somebody tells me that there is something which has worked particularly well in South Karelia. And probably most of you do not know where South Karelia is. It's on the border between Finland and Russia. 130,000 inhabitants, a relatively small surface, extreme winter conditions, transporting patients in winter is very difficult. They have a totally integrated social health system and so on, Nordic culture and so on. Andalusia is slightly different. It's 8.4 million inhabitants. They never see the snow except at the top of the Sierra Nevada. Extreme summer condition is very hot there. I mean, the family is still doing a lot for supporting people, elderly people. Actually, most of it is done by families. So, if I am the Minister of Health of Andalusia, I should ask myself, should I run a new trial in my turf to see if it works, and before I make any decision? I might do that, but that has two major consequences. One is delay, at least 5 years. Years ago, the Federal Ministry of Health in Germany said that for introducing telemedicine, they needed a trial with 10,000 people followed for 5 years, and they were probably right if you want to have statistical evidence. And the second aspect, I will spend an awful lot of money. So, can we go beyond best practice sharing? I think so. And actually, my friend and colleague Panos will try to convince you even more than me. And I've always asked myself, what if we're able to use a mathematical model for forecasting the weather? We shouldn't be able to use models in the care sector. And even more important, can we close the loop and create a continuum where we go from prediction to implementation of services, and we support the implementation with the change management toolbox. We evaluate the results, and thanks to the results, we improve the predictive model in such a way that next time we use it, it will be even more accurate. So fundamentally, what I would like to see and what we try to do at this point in time is to close in this loop, from prediction to making decision, from making decision to implement, evaluating, and improving again the predictive models. So what's a predictive models? I think you have in mind what that is. Fundamentally, you have some independent variables. You have a transaction probability from one state to another, and you calculate the dependent variables. And fundamentally, you use statistical model and simulations. So actually what you do, you try, you make an assessment, you use modeling techniques, you build a model, you run the model, you validate the model, and you try to see if in reality the model has actually predicted the right results. If not, you start again and you improve it over time. By doing that, we can probably reduce by far the time for decision-making and to do decision-making based on a far better quality of information that has been done until now. Questions for the end, I understand. And this is the company I have the pleasure of managing.